What are angiograms, X-rays, CT scans, MRI, and ultrasound? An angiogram of the heart is a test that shows if your heart's blood vessels are blocked or narrowed. It is better to do it at a hospital, where there if provision for bypass surgery, in case something goes wrong. Doctors use it to find out why you have chest pain or trouble breathing. It works by using a special dye and X-rays to take pictures of your heart's arteries. About 2 million people have a heart angiogram every year. The test usually takes less than an hour. You are awake, but you get medicine to help you relax. There are many benefits to having a heart angiogram. The biggest benefit is that it helps doctors see if your heart is getting enough blood. If there is a blockage, doctors can find it right away. About 85% of people who have chest pain get a clear answer from this test. If a blockage is found, doctors can fix it during the same visit by putting in a small tube called a stent. This test can save lives. Research shows that people who get an angiogram and then treatment for blockages are 30% less likely to have a heart attack in the next year. It also helps doctors decide if you need more treatment, like surgery or medicine. But there are some risks with a heart angiogram. The most common risk is bruising or bleeding where the tube goes into your arm or leg. This happens in about 5% of people. Some people, about 1%, may have an allergic reaction to the dye. There is a small risk of kidney problems, especially if you already have kidney disease. This happens in about 2 to 3% of people. Serious problems are rare, but they can happen. Less than 1 in 1,000 people have a heart attack or stroke during the test. The risk of dying from an angiogram is very low, about 1 in 10,000. Most people go home the same day. You may feel tired, but you can usually get back to normal activities in a day or two. So, a heart angiogram is a helpful test to find heart problems. It gives clear answers and can lead to fast treatment. But like any test, it has some risks. Talk to your doctor about your own risks and benefits before you have the test. But that is not the end of the story. You still need to protect the stent if stent is placed inside. That is healthy food, moderate exercise, and healthy lifestyle. Body scans are tests that help doctors see what is happening inside your body. They work like a camera that takes pictures of your bones, organs, or tissues. Each one works in a different way and comes with its own risks and benefits. Some risks are very small, but it is good to know about them. X-rays are probably the most common. They work by sending a small amount of radiation through your body. This makes a picture of your bones or organs. X-rays are quick and usually do not hurt. You might get an X-ray if you break a bone or have a cough that will not go away. But X-rays use radiation, and that means there is a very small risk. Research shows that the risk of getting cancer from 100 X-rays is about 1%. Most people do not have any problems with X-rays. To know about all other type of scans, see the full video in the link below. Surprising facts about medical scans. Remember to click the like button and subscribe. The next is the CT scan. CT stands for computed tomography. CT scans work a bit like X-rays, but they take lots of pictures from different angles. Then, a computer puts the pictures together to make a detailed image of the inside of your body. CT scans are very helpful for finding problems like tumors, infections, or injuries. But CT scans use more radiation than regular X-rays. That is about 100 times more than a single X-ray. Because of this, the risk of cancer from a CT scan is a little higher. So for every 1,000 people who get a CT scan, one person might get cancer from it. That is a considerable risk, but it is something to think about. Next is MRI. MRI stands for magnetic resonance imaging. They use strong magnets and radio waves to make pictures of your body. There is no radiation. MRI is very good for looking at soft tissues, like your brain, muscles, or joints. But MRI can be a problem for people who have metal in their body, like pacemakers or metal pins. The strong magnets can make metal move or heat up. That can be dangerous. So before you get an MRI, the doctor will always ask if you have any metal in your body. Most people have no problems with MRI. It is safe for children and pregnant women too. But the scan can take a long time and the machine is loud. Another common scan is the ultrasound. Ultrasound scans use sound waves to make pictures of the inside of your body. The sound waves bounce off your organs and tissues, and a computer turns them into images. Ultrasound is often used during pregnancy to check on the baby. It is also used to look at the heart, liver, or other organs. Ultrasound does not use any radiation at all. That means there is no risk of cancer from ultrasound. It is very safe for almost everyone. Sometimes the gel they use on your skin can feel cold or sticky, but that is about it. Ultrasound is quick and painless. Let's look at some numbers again. X-ray radiation dose is about 0.1 millisieverts per scan. CT scan radiation dose is about 10 millisieverts per scan. MRI, no radiation dose. Ultrasound, no radiation dose. The risk of cancer from one X-ray is about 0.01% higher than normal. The risk of cancer from one CT scan is about 0.1% higher than normal. MRI and ultrasound do not increase the risk of cancer from radiation. But there are a few other things to keep in mind. Some people can have allergic reactions to the dye used in CT scans or MRI scans. The dye helps make the pictures clearer. Most people do not have any problems, but a few people can get a rash or feel sick. Very rarely, the reaction can be serious. If you have allergies, tell your doctor before the scan. Some scans can make you feel uncomfortable. MRI machines are loud and can make some people feel trapped. CT scans and X-rays are quick, but you might have to hold your breath or stay very still. Ultrasound is usually easy, but sometimes the doctor needs to press hard with the probe, which can be uncomfortable. Doctors always think about the risks and benefits before ordering a scan. They want to make sure the scan will help find the problem or help plan your treatment. If you have questions or worries about a scan, ask your doctor. They can explain why you need the scan and what to expect. To sum up, body scans are helpful tools that let doctors see inside your body. X-rays and CT scans use radiation, but the risk is small. MRI and ultrasound do not use radiation, so they are very safe for most people. But each scan works in a different way and has its own risks. Doctors use them only when needed to help keep you healthy. Do not forget to click the like button and subscribe. References are in the comments section. Thanks very much for watching this video. On the screen, you see an essential video for you. Thanks very much for watching this video.